You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, hot topic, what you need to know about dental implants. Teeth in a day. With us, we have an expert on the topic, a board-certified oral and maxillofacial surgeon, Dr. Richards. Dr. Richards, welcome to the program.
Hi, Randy.
All right.
Thank you for having me.
Now, before we get into today's topic, tell us a little bit about your center. I mean, it's one of the biggest, I guess.
Well, it is
big.
Definitely one of the biggest in the United States.
Okay.
We put this together. It was a package that took us several years to put together. Dr. Musser and I have been together for 29 years, and
wow.
This is sort of a culmination of our professional careers and being able to make it happen.
Now, you guys have made this place, I guess, a little bit different than a typical dental office, right? I guess you walk in, there's a theater. Tell me about this.
Well, I think that's what makes our practice unique. And I think when a person drives up to the front, they feel it.
Really?
They see it.
They
already
okay.
know. They
All
already
right.
know they're going to have a unique experience. And then when they walk into the foyer, it's very well appointed, not medical, and they look to the left and they see a 35-seat theater, which is our waiting area.
Is that right? So the waiting area is a theater.
It takes them another layer deeper into the unique experience.
Now, the interesting part is, I guess you're an oral maxillofacial surgeon, and to see a specialist like you, they don't need a referral from their general dentist. They can go direct for dental implants.
That's correct.
Is that right?
That's correct.
Is it more, though, to go to a specialist?
What we have found is that the more experienced doctors seem to charge less, and the less experienced doctors seem to charge more.
Do you know why that's the case?
I have no idea, but we do so much of this type of work that we pretty much have it down.
You know, people always ask me, they say, Randy, they email us on wellnesshour.com, who should I go to? And we try not to endorse the doctors.
Right.
I always say, I'm just asking the questions. But my big saying is, look for a specialist. So in the world of dental implants, you're the specialist.
We are.
I mean, there's nobody can argue with that?
I don't think anyone would argue with
Okay.
that. And I think, like with anything, I mean, if you're going to have something done, you want to go to someone who does it every day. Someone who can do it with their eyes closed. You don't want to go to somebody who does it occasionally.
And you do everything under one roof.
Everything.
So that way you can do this teeth in a day, which sounds like an exaggeration. Some of the dentures goes in, they get it all done in one day.
That's right.
Not an exaggeration.
Not an exaggeration.
Is this the happiest group of patients, dental implant patients, people that were wearing dentures, you give them something fixed set of teeth in their mouth?
Well, it is. You know, as an oral surgeon, we do a lot of things that are rough and destructive, it seems. But with dental implants, we're doing something gentle and constructive. And so
gentle, though? I mean, it seems very painful. Very painful.
Gentle.
It's not?
Minimal discomfort. Even with the teeth in a day concept that you mentioned, and I know that we'll talk about that. Under one roof, asleep, gentle, minimal discomfort.
So they go in without teeth, they come out, they wake up, and they have teeth.
And they have teeth.
Is it that simple, though?
It is that simple, but what the viewers have to understand is they're looking at 60 years of experience.
Yeah.
This is not something that you do right out of school.
So what are the different categories of dental implant patients that you see?
Well, I think first and foremost are the denture wearers. And some denture wearers are unhappy and know they're unhappy. Yeah. And other denture wearers are unhappy, but they just don't really know they're unhappy. Because
what does that mean?
Even with a great fitting denture, they're only chewing with about 15% efficiency.
Is that right?
That's right.
Okay.
So the next group I'd say are the people who are just scared of the dentist. And they haven't been to the dentist 5, 10, 15, or 20 years. And they know they have a problem. They know they have a mouthful of bad teeth. They're either decayed or they have gum disease. Okay. And they know their teeth need to have something.
They're just afraid of the dentist.
They're just
is that
scared
what it
of
is?
the dentist. They're scared of the dentist. And they don't know that there's hope because they're not informed.
Do they tell you that, though?
Yes. They
tell
just don't know. We just had no idea because they weren't informed. Nobody tells them. They don't go to the dentist.
Okay.
So they hear about it maybe from another person who's had something or the media, computer media or visual media.
So they've been told somewhere along the line, their general dentist, your teeth have to go, but they do nothing.
But
they hide their smiles?
A lot of times people come to us directly because they aren't told by the dentist.
Really?
Because a lot of dentists don't keep abreast of current concepts in what we do, and so they don't even know to be able to tell their patient. But anyway, that's another group.
Okay.
A third group is a person who's being told by their dentist that they're going to lose their teeth due to gum disease. Mm-hmm. Another group would be a person who has been wearing a denture and they become dissatisfied and their dentist says, you don't have enough bone for me to make another denture for you.
Okay.
Person missing one tooth. A person who is born without a tooth, we call that a congenitally missing tooth. Or a person who's been in an accident, motorcycle accident.
What are the age ranges then of these different?
You know, on any given day, I may talk to a 16-year-old or a 90-year-old.
90. Why would a 90-year-old want to get a dental implant?
Well, you know, our priorities change as we get older.
Okay.
And I think eating becomes pretty high up on the
Good point.
priority list as we get older.
Yeah, your life, I guess, revolves around eating.
Yeah, I took care of a 96-year-old gentleman about 10 years
96.
ago. 96.
But don't they fall out? I mean, somebody that old.
Don't the implants fall out?
I mean, they can.
Absolutely not.
So they could stay in a 90-year-old's
Absolutely.
mouth. Do you think
Yeah.
some people? Now, look, you know, anticipating this interview, and I told this to your partner as well, that my mother, you know, I was telling, she's 73. She's been in dentures since 28 years old, and she says her medical doctor says she's too old for dental implants because of bone or something like that.
If she fell and broke her hip, would he tell her he's too old to have that repaired?
Okay.
It just simply is not the case. And so we judge people on their health rather than their age. I've placed implants on a 102-year-old.
Really?
Yeah.
Is that the world record by any chance?
Probably not.
102.
Probably not. I'd put some implants into a lady who 96, and she ran the exercise class at her complex where she lived. In Florida, we
So
see a
age
lot
should
of,
not hold you back because 70, 80 years old in Florida and here in California, very young.
very
young to them.
Yeah.
So that's very interesting. And what about pain, though? It sounds very painful going into the bone.
You know, I hate to see you even mention that word, really.
All right.
Because that word really isn't in my vocabulary.
They don't complain about it? I mean, it's not a big...
Most people are shocked. They have a preconceived notion of what they think it's going to be,
Yeah.
but they're shocked, whether it's a single tooth replacement or one of these full upper and lower full mouth rehabilitations. Most people are truly shocked. Now, they may take some over-the-counter medication, some Tylenol or ibuprofen.
Is that common, by the way, that they don't need pain meds the next day?
Very common.
Really?
Mm-hmm. Sure is.
Okay. Now, define this teeth in a day. What does that mean, teeth in a day?
That means that a person could come into my office in the morning with a denture.
All right.
And I know this is going to sound incredible, but I put them to sleep,
Okay.
place the implants, I do impressions and bite registrations and all those technical things that we as dentists do.
Okay.
That takes about 2 hours per jaw. And then I have a specially trained laboratory technician that reworks that person's denture. That takes about 3 hours. And when I get that back, I literally, and I hate to use the term, I
Okay.
literally bolt it into their mouth. It sits on the implants.
So it's a fixed set of teeth in their
It's
mouth.
a fixed set of teeth in their mouth.
Now, you say that you can give people their teeth back and you change their lives. For example.
Absolutely, would change their lives. I have some pictures here
All right.
of people who've had their lives changed. This gentleman,
Now, he's smiling there, by the way?
he is smiling.
Okay.
Absolutely. And the common theme here is people who have ugly teeth don't want to smile. And today, the way we look is very important. And teeth are right in the middle of our face when we smile. You
Okay.
don't cover them up with clothes.
All dentists feel that teeth are important, though.
Absolutely. Well, they are important.
Okay, okay.
And not to mention bad breath. And,
Okay.
and who wants to kiss their spouse, when they have
Oh, my
teeth that
goodness.
look like this? So,
Now, that's rare. That has to be rare right there.
Randy,
that bad.
it's not rare. And this was one category of person that we talked about a few minutes ago when you asked me who is a candidate. A person who hasn't been to the dentist in 5, 10, 15, or 20 years and who is scared and who feels like there's no hope.
So this person hides their smile.
Absolutely. They hide their smile.
So with that patient, you're on the consult. I mean, what do you say to them?
Well, after a thorough evaluation, his teeth had to go. There's no question about it. And his options were very limited. He could go into a set of regular full dentures or plates, or he could have implant-supported teeth. And he elected to have implant-supported teeth.
Now, by the way, backing up, this person who put it off 10, 15 years, how did he finally decide to do something about it? He saw one of your seminars that you do, saw you on the internet.
the friend of a friend of a friend,
Okay.
a word of mouth kind of thing.
Okay, okay.
Word of mouth.
Said you got to get in there.
Right. Got
Okay.
to get in there. So one day, okay, and I want the viewers to know that they have not misunderstood what you and I are talking about.
Okay.
And one day, asleep in my office, they start the picture that we showed
Wow.
before, and they end up like this.
Let me see that before picture side by side. That is, Well, you know what? Huge difference. He looks years younger.
What we find is that people just start taking care of themselves when they have a better self-image. Haircuts, makeup,
Okay.
the way they dress, they smile, they seem happier.